You're on.
I am on. Hello, people. How's it going? All right. Let's just chat a little bit because I just want to get everybody organized and settled in their chairs and get a cup of coffee, grab your glass of water, whatever it might be. You're in this for probably about, I'd like to think maybe 30. Let's work on 40 minutes. And if we're done a little bit shorter, bonus, then you can go on with your day. It is Easter weekend, so you got a chance to go home and get yourself organized and celebrate with yourself, maybe. But on that note, I heard rumor says that there's a big sale on turkeys right now, just saying. So you might want to get on down and get them to deliver something to your front doorstep. So we're going to the lake. There's only 3 of us in the family. And I'm thinking turkey might be a great idea. But anyways, we are going to talk a little bit about a few different things that are going to be a bit off the subject lines of some of the things we talked last week. But that doesn't mean that if you have questions that you want to ask that I've not addressed, please do send them to us still. If you want to message us after, absolutely do that as well. If we have time at the end, I've got a section that's just basically called miscellaneous. And what I'll do is I'll try to really just talk about some of those things that as they pop into my head as well. But today, we're going to talk about group communication. And yes, COVID has heightened it. And at the end of the day, we're looking at favorites and we're looking at faux pas because there's a lot of faux pas going on right now. So I think it's really important to really drill down how incredibly important communication is going to be through this process. So I think we're almost ready. Do you want me to start rolling, Colton? Or I can just say, while I'm waiting, if anybody has any new ideas on Netflix series, I'm like one of those people on the dark side. So I tend to like Ozark, Blacklist. I would love to get any suggestions. It is the long weekend, and I will be at the lake, and I'll have a lot of time to watch TV. So bring them on.
Yeah, we figured this is Colton here.
Colton.
Tuning in from
yes,
the
there's
side.
Colton.
We thought while we waited for everyone to get on, we'd see some Netflix. No, you stay there. I'm not going into your space.
Oh, okay.
We'd get some Netflix recommendations. I know I just finished watching the whole Harry Potter series in about 10 days.
That's too deep for me.
Netflix right now. Too deep. Harry Potter's not deep.
I don't know. It's just
too lengthy.
I don't know. It's just not. It's not my thing.
That's fair enough.
It's not my thing. But Ozark is not a lot of people's things because that's dark. Not just deep, but dark.
No spoilers. I haven't watched the 3rd season
yet.
No,
it's good. Oof.
Yeah,
it's good.
Yeah, fair.
So,
we'd love to hear some recommendations. Again, we just want to give a minute for everyone to get settled on. I see the number count going up as we get going here, just because it takes a couple minutes for people to get the link pulled up.
Yeah, I'm excited. I have got my daughter back after she spent 2 weeks in isolation at the lake. She came from Australia, so if you want a level of stress at heightened, that was it for me. And she quite closely watches what's going on in Australia because she was there for a study abroad and talking with her friends that some are still there actually. Some have made decisions to stay there. Some are now having difficulty. I know she said New Zealand has now completely stopped all flights coming out. So I think that's almost pretty much everywhere. Is that it'd be crazy to think anybody wants to travel right now, especially out of Canada, if you even could get out of Canada right now. When we talked about the travel benefit last 2 webinars, there was always that question that popped out about the essential services truck drivers and whether or not they were covered for group benefits and out-of-country coverage. Yes, they are, still are. We do need them, and I want to give an absolute shout-out, high five to the essential services for these people that have committed to be there to support us, help us, and left themselves very vulnerable to being obviously in the whole line of fire of COVID. So thank you very much. A lot of these are probably your children that are working at the retail outlets, the grocery stores and things like that. So when we're whining and complaining about being home in isolation, honestly, we should just watch that because these are the people that are out there and they're probably very, very nervous and very, very stressed. We need to think about whether or not we'd rather be there or we'd rather be at home in our safety of our home environment. So I think we're doing good. Colton, can I start rolling?
Yeah, you get going.
All right, here we go. So again, thank you for joining in. This is Deb Wiegers Financial and Benefits. I think the last few times I even forgot to say that. But anyways, we're here to talk about benefits, COVID-related benefits. The thing that we're going to do today is we're going to talk about, we're looking at moving this into a bit of a series. So we spent a lot of time and have exhausted some of the primary subject lines as it relates to the initial stages or the waves that we talked about in benefits. And it's still going to be a continuation. I was watching this morning. They're saying, please, everybody beware. It is Easter weekend, and you still need to adhere to the same rules. If we cross those lines, we could essentially double the infection rate very, very quickly. So it is very important that the government is still providing that high level of communication to us. And we're going to talk about that as it relates to benefits, COVID. There is some communication favorites I'm going to address, but there's a lot, as I'd mentioned, a lot of faux pas, because you just cannot be thinking about saying things and not getting clarity. Do not get into assumptions on very many levels. We'll go through that. So the one thing that we did say, as the Uyghurs Financial, we are really keen on and have in the past month, pre-COVID, talked a lot about what we want to do, how benefits sits in with the overall organizational well-being, and our goal is to help you achieve a healthier bottom line on all levels. One of those areas that we really focus a lot in is communication, education, communication. That's key in all this. So when working with my preferred partners, we said this would be really fun to really collaborate now that we've got a lot of face video time to do this. So look forward to the series that we're going to bring in for the next few sessions that will bring in my preferred guests. And we will talk about some of those things as it relates to their area of expertise that integrates with benefits. So it is about benefits, but there's going to be a direct and indirect correlation as we see these series progress. And yes, you're going to see a little bit of a discussion still on the line of COVID, but obviously things will start to settle down, and business will, on all levels, still become very important as we start to look at ways that we can start to ramp up and carry on with our new normal, I guess you would call it that. So on communications, our favorite is we're going to be looking at a lot of success and discussion around, we're talking a lot of succession around, we're doing, what is that? Could you see that, Colt?
I saw a bit on the screen.
Oh my gosh, it's the Easter Bunny. Oh my gosh, I'm so excited because you know what? I heard we were just going to talk about workplace and workplace chat with Uyghurs. Easter Bunny, it's so nice to see you. Oh, thank you for coming. I heard that you were visiting and dropping off bags, and I was actually quite disappointed I didn't get one. I hope you brought one for me today. Oh, thank you. See, it is Easter, and even though we can't celebrate the normal way, I'm excited that I might. Oh my gosh. Look at it. I've got my treat. Oh, thank you, Easter Bunny, and thank you for not forgetting about me. You just made my day. Have a good one. That is so cool. Oh my gosh. Colton?
You gonna share that with me?
I might. I just might later. I don't know. I touched it. Now it's all mine. So, okay, sorry. But we were talking about communication. So one thing that we've been doing at our organization is that in order to work remote and work as effectively as we can, we had integrated, we had been talking about it as everything else, we've been escalating all sorts of things. And one of the things we wanted to do to have a better opportunity to work with our team as they work remotely as we implemented Workplace. So I don't know if anybody's heard of it, but it's the coolest thing ever. It's allowed us to stay connected. I guess if I could give an analogy, it's kind of like Facebook, but it certainly allows us to get on board with video chat time. So we can do our management meetings on chat time. We can do our group benefits team huddle on chat time. We can have that one-on-one face-to-face interaction. It's been incredible. So I encourage you, we still use email, of course. We still use phones. But it has made a huge difference in terms of how we stay connected as a team. And that's really important because obviously with part of isolation, it heightens levels of stress. And one of the things that we've talked about a few times is, that reaching out to your employees and how do you keep that level of connection there? Because yes, stress levels are high. And I just want to really just briefly show you one. I've always been a keen fan of this book. And it's called The Coping Crisis. And it's by Dr. Bill Howitt. I saw him at a session for a pension benefits conference a few years back. And when he presented, it was certainly something that became and still remains on my radar. In this book, it's a very you can tell by the words. I don't know if you can tell, but the words are big, and I love it. It's simple, it's straightforward, and it's just a really great read. And in terms of integrating it with your people, there's 2 areas I always tell my clients, because I send out many of these books, and perhaps maybe at the end, if you want to send a note, how do we want to do this, Cole? Because I certainly would love to share a few of these books out with the people, because we want to have them connect with us.
Yeah, send us an email, send Deb an email, we'll post it in the comments. And if you want any kind of resources that we talk about right now, like the coping crisis book, or as we get going, the layoff toolkit, we'll talk about how you can get access to that. And by all means, these are resources we want to share with you guys, and we don't want to hoard them all to ourselves. And feel free to share them and pass this along to anyone you think would be valuable, any business owner, friends, and managers that you have that you think would get some value out of this. We're happy to share the resources. Sorry, it feels weird talking from behind the screen, but we're trying to.
I'm looking, so it doesn't. I'm looking,
yeah.
but I'm looking the wrong way, it seems, too. But
I'd like to jump into on workplace. This tool has honestly been a game changer for our company. We actually were already looking at rolling it out for communication, strictly internal communication, just to be clear. So it's just keeping the team connected remotely. And it, as Deb mentioned, it has instant messaging options, video calling, regular calling. It's just a lot easier way for people to get to see each other's smiling faces without having to be in the same building as each other. We were already intending to roll it out. We just moved that timeline ahead by a few weeks. It's pretty inexpensive, I would say, compared to anything lost when you aren't able to talk to your team for weeks on end. In a more meaningful, connected way, and we'd be happy to share some experience about that and information as well. We'll post some more of that in the benefits frequently asked questions group, which we have the link for on this post as well. So if you want to join that group, just request, and we'll be sharing some more info on workplace there too.
Good. Thank you. So 2 things, and I'm going to go into the business of the benefits stuff, but I just wanted to really emphasize how incredibly, I think, great this book is. And in this time, I think it's an actual perfect time to start to integrate it. But 2 areas, there's one, and again, you can't see it, but I'm just trying to figure out the lighting here. Okay, there it is. Okay, so you see there's a chart that's there. And when you read it, you'll understand how important this chart is, because it talks about the 5 life challenges and how that plays into stress and mental well-being, and how we now need to be aware of that, so that when we're trying to talk about our coping mechanisms and how we deal with our stress levels, this you need to understand before you can even move forward. And so the 5 life challenges, I'll read them to you, that you need to be aware of is, number 1, we know, is money. So when we talked about the series and how we want to roll out our partnerships, financial literacy is going to be one of those very important topic items, because it's one of the 5 life challenges that people have. Number 2, career. Whether or not they're happy where they're at, they're getting the training, the personal development, the training development, that becomes important. Number 3, relationships. This is going to be tested at the ultimate highest right now as we're going through this COVID pandemic. Number 4 and 5, self-acceptance and health. Now, they fall in the bottom. And see, this is where the problem becomes, because they only say that you can manage 3 before the apple cart tips. So if we're not even looking at self-acceptance and health as one of those challenges, because we just can't get to it, that's problematic. Because now if our health is failing, which kind of is like now what we're going to be faced with, is that we're being stressed at the highest levels, and our health is being stressed at the highest levels. So as a company looking to take care of you people, it's just not enough to say, go tap into EAP and figure it out from there. You really need to drill it down and say, what are those things we can do? And if there's things that you can share that, really it's not just about us sharing to our employees, it's about really putting them in this mix of accountability. And maybe that is something that you might turn around and create challenges or campaigns or contests. Even though we're all at home, we still can do it. The other one I want to reference is they talk about the level of stress. How stressed are you on a scale of 1 to 5? Well, depending on the day, sometimes we might be a 6+. So there again, it's a chart that identifies where you are in the stress levels. Sorry, it's really awkward. There we go. Anyways, that's why you got to read the book. But I was thinking about this when I was rereading some of the parts of the book, and one of the things that kind of popped up in my brain, they talk about the number one stress is everybody needs stress. It's just like stress is good, stress is healthy as long as it's at a number one level. When you're at a number five, it's very problematic. We're talking about chronic depression. We're talking about bipolar. We're talking about clinically ill, mentally ill, and there's that hovering in between. And I kind of look at number three, and it identifies stress as situational stress. So it's not like you're stressed every day as soon as you get out of bed. It's stressful. It is a situation that stresses you. So that's why they'll say, maybe it's something at home, maybe it's a family member, maybe it's a friend. But right now it's COVID. I believe that this is a situational stress. So we need to understand that so that we are all in this together. And you almost have to be talking yourself off the cliff some days because it can get kind of scary. And just understand this is something that will pass. We just got to push through it. We just all got to push through it. It will pass. So again, that book is great when you're talking about mental well-being, trying to be there for your employees and the things that you need to do to make sure that business is happening and you can set yourself up for when things start to settle, as normal as it will be, back to business. Okay, there's where we're at. So while at work, let's talk about the benefit stuff. So while at work, a lot of times we're getting the questions of, I've got to be thinking about, and this is not my area of expertise. We have got a lot of great colleagues that are a little bit more into this space of EI and the programs that they have. But while at work, the one thing that we're seeing on the benefit side is either or. You're going to be looking at layoff. Well, first of all, maybe closing the doors, unfortunately. Then there's a layoff. But before we get there, maybe we're hoping we can reduce our hours, or we can work at some kind of a work share program, which again, EI is there to subsidize on those levels. If that is what's happening in your world, you need to have a very strong communication with your people, but more importantly, as important, with the insurance company, because anything you change in your day-to-day work environment is going to directly impact what you're going to do on the benefit side. So if you've got John who's now working at 50% capacity, you need to connect with the insurance company. We always say to our clients, contact us so we can guide you through, because everything changes with respect to the benefits they're going to get for life insurance and disability. Every time you pull that down, their insurance, it will be reduced at that same level. You need to let them know that. The other thing is the insurance companies are producing bills. If you don't tell them that you've reduced hours, you're going to get a bill based on 100%, which doesn't make any sense either. So communication becomes very, very important on that. The other thing that we're still getting a lot of confusion on is what do I do? Where do I go if I think the one that's we're stuck in is the middle one. Sick, COVID, get it. I'm not sick. I just choose to isolate, get it. It's the in between. I'm symptomatic. I can't get through to 811. What we're finding is a lot of people are thinking, well, put the claim in for short-term disability. But you're setting the employees up for potentially a disappointment, because it goes back to disability benefits are based on medically qualified. So you have to be sick. So if you send them down the short-term disability path and they put the application in, and we've had this situation where someone had bad flu and cold symptoms, and this individual said, I think it's just what it is. But you can't do that anymore. You can't just say, I think it's just a cold. So he's at home, but he's put his claim in for short-term. But at the end of the day, it didn't meet the definition of disability. So he was declined. So now the disappointment is you got to go back to the employee. You got to tell him, sorry that it didn't go through. Now he's got to go through the EI side. And as far as unless someone wants to challenge me on this, as far as I know, because the government has rolled this out and they're trying to maintain, the safety and spreading, the safety guards and spreading, is that they're saying, put the claim in for a sickness. We're going to give 2 weeks. At that point, they're probably going to reassess the claim. When they get around to it, I have no idea. I don't think we all know, because they're jammed up like no tomorrow. So the key is, though, you'd want to promise the least and deliver the most. Tell them to put the application in for EI. Obviously, if something was to turn into a situation where it is a disability, it's going to be sent back over to the short-term disability side. I can't make that any more clear, because right now you don't want to have the employees set up for something that they may not get. It just doesn't go over very well. The faux pas is that. Send them to EI first, not short term. Okay, so communicate that and document that so that the employee knows exactly where they sit. Temporary layoff, it's still buzzing. There's lots of that going on, unfortunately, but that's what we're dealing with. And I talk a lot and I reemphasize the importance. You have to understand Service Canada is there to do a job on the level that they have, but they don't connect their world with benefits. It's not their job to do that. So at the end of the day, what we're looking at is we need to make sure that if you're going to be looking at a layoff, it is your choice as an employer to lay off and extend benefits. There's allowable extension timeframes. And life, health, and dental, those are the ones that are quite common and they're easy to do. The disability is the one we always need to focus on. The return to work date, you want it to align with the return to work date has to align with the allowable extension that your insurance carrier is giving you on the disability. If it's 90 days, you want the return to work date to be 90 days or sooner. This is just an arbitrary number. We don't know when that return to work date is going to be. The government's going to tell you what they think they should say, but you cannot put on there when COVID passes. That's been told to us, because that does nothing to align with your 90-day or your 60-day or your 120-day allowable extension for disability if you're extending benefits to the employees. If you're extending the benefits, we need to still nail down communication. The faux pas, it's great. Employers, they're telling us that they're going to just pay the first month of premium, maybe the first 2 months of premium, just going to see where it all goes. And the question I always ask, did you communicate an end date on that? Did you put it into writing? Is the employee clear on what your expectation is or your obligation is when it comes to you paying that premium? You need to be very clear on that, because again, very disappointing if they felt or assumed that you were just going to be there for the next, we don't know, 2, 3, 4 months. So you need to put that into place and make that communication very clear with the employee. And you need to determine how you're going to go about paying the premiums, because the benefit doesn't stay in place unless the premiums stay in place. So we get a lot of people just remaining with what they've had before they went into this, the co-share, right? You've got a premium that you typically would share. If you're choosing to change and you want to pay the premium 100% as the employer, I say go with caution, because we don't know and we're still trying to sort it out. We need to know that it's going to be compliant with CRA. And the best thing to do is probably get advice from your accountant as to what you might be doing as it relates to you paying 100% of the premium. Because if you as the employer pay 100%, you need to understand that there is a potential risk that you're turning your benefit for disability to a taxable benefit. And right now, most all of our clients are set up so that they have a tax-free benefit. That's a big difference if this employee needs to claim. And again, communication, we tell the clients this is very sensitive. Communication should come back to us so we can guide you through properly. But absolutely most importantly, if you don't have a broker that's there for you, you need to connect with your broker or your insurance company and let them know what's going on. And that's where, and I always say, you're going, oh yeah, sure, Dab. But that's where we put all of this into this toolkit. This is obviously a hard copy. Life is all about online. But this is where we get into those very specific questions. So we've developed a worksheet. And I can't do that, sorry. A worksheet that says, we have this conversation. What is your decision? And we get you to write it down, and then it's put in the file so that somewhere down the road, if questions arise, you've got that information in writing. So again, the premium, you can decide how you want to do it, but you need to be clear on what your expectation is. You can change that later, but just don't go, well, we'll just do it for now. The important part too, if you're laying off, right now this is all about temporary layoff. If things start to change for you and you're going into a permanent layoff, everything else changes on the benefit side. So you need to be, again, communicating with your broker and let you know, we are doing permanent layoffs, and then that changes how the extension of benefits, if the extension of benefits will be there. If it goes beyond 6 months, that's kind of like the timeline. Now we're talking about reinstatement. So again, pre-existing conditions for disability, long-term disability, will now become a communication issue, right? You need to let them know if it goes beyond. We're going to hope it doesn't, but if it does, there is changes. So that's kind of like the number to keep in mind, is that 6-month mark on that. And again, I can't stress enough, if you're doing anything that relates to hours being reduced, you need to communicate that, as it rolls right into the billing amount. But the other thing is, you want to make sure that whatever you're putting on the ROE as the salary, it has to be the same. You want it the same as the billing, because insurance companies are a little bit all over the map. But typically what they're going to say is that we're going to pay the benefit based on what the bill tells us. If you got John set up as a $50,000 salary, that's what they're going to pay out. But when push comes to shove, you've been paying for a benefit that might not even be there. So it just gets messy. Again, strong communication on that. How are we doing, Colt?
We are 11:25. I guess we could do, while you go through your notes. Does anyone have any questions? Again, a reminder, if you have a question while we're going here, feel free to put it in the comments and we'll answer it. As well, too, if it's something you would rather send to us direct and not post publicly, you can send us a message on Facebook, and then we'll open that up and Deb can answer live here. So at any point in time, if you have a question or comment on any of the topics that Deb's going through, definitely jump right in. Post in the comments or send us a message.
And shout out Jennifer, you're awesome. Thank you, and I thank you for letting me know that this is going to be good information for you. So that's great. Let's move into healthcare. A couple things to be thinking about. I know that insurance companies are telling you that they're going to still keep the plan design the same. The big one that's coming up now is 90-day refills. Not that we wanted to think it's like, but kind of think like it's the toilet paper thing, is that everybody's getting all excited and they want to go out and they want to stockpile. And that is not going to be potentially an option. I'm hearing, I've got, certainly a good feedback from someone who's quite involved with the Pharmacy Association. And out east is when we kind of get to hear what's going on, and then it slowly makes its way over to Saskatchewan. But I already know that Saskatchewan pharmacies are now just doing 30-day refills. And I would suspect it really would depend on what it is you're getting. But if they feel that there's a risk that there could be a shortage, because this all goes back to supply and demand. And so at the end of the day, if they can't get this produced and delivered to a satisfaction level to supply, that will jam up the opportunity to continue on a 90-day supply. So I do have a good friend. She's a pharmacist and a business owner. And she says, I am that person, Deb, that I'm only allowing for 30 days. If it's for chronic conditions, you may be allowed to come back after 14 days and ask to get another refill. So they don't obviously want to leave you with any gaps in your therapy and your drug needs. So, but again, just because it says 90 days on the group plan doesn't mean that's the case. You need to communicate that to an employee, because they might get all excited if they find out they can't. The other thing is, yes, virtual care is coming in. All the insurance companies telling you they're accepting it. Here's what we're finding. It's still a little bit slow in the uptake. So if anybody out there has come across any types of providers that are actually in that physical care space, let us know. We'll forward that out. I know North 49 is one that's taking virtual care appointments for physiotherapy, which is a really important one. I know that the Canadian Back Institute is doing it, the Workers' Compensation and SGI, so the government programs are certainly in that space. Their prior authorization, another one on the drugs, be very careful, because these are people that are, have a very high need, and they're maybe potentially on, high cost drugs that are monitored very closely with the insurance company, because they're not just giving these out, they're putting them through a process and determining if this isn't what's working, then they're going to move to the next step, then they're going to move to the next step. So we're now getting into very high dollar amounts of claims. So there is going to be appointments and catch-ups on going, okay, now we need to decide if we're going to continue on this path. And there is expiry dates where they review or reevaluate that. That is now, kind of coming to an end for some people. But what I'm being told is that not to worry. They're not going to be as restrictive terms of what it is they need in order to continue on. I haven't got an absolute 100% answer on that, but if you do come up with that situation, when you have someone who's got, a medical need that requires high attention and high drug costs, that might be a bump in the road for them. Health card. I think I mentioned it last time. I mentioned it on the newsletter that we sent out yesterday. Remind your people to get a health card update. Don't let them expire. Again, insurance companies are saying, you know what, if it's below the radar, we may not even notice it. You'll put a claim in, they may not find out. But it's kind of like the CRA, like you might be that one person that gets the audit. And what I am being told, the example would be high drug costs. Because you got to remember, all of us are in a connection with a government program. So with group plans, they're saying, you can submit the drugs, but if it gets to a number, they've just flagged a number, they're saying now we need to know if this is a claim that should go to the government, the special support program, and they will suspend, not decline, they'll suspend it until they know the government's going to kick in. Well, that's not going to happen. If they don't have a current health card, there is no coverage. And therefore, the insurance company will reserve the right to decline that. And if there's any other high cost needs, this person's disabled, they may not be able to get the claim through because everything weighs on what they get for medical evidence. And if they can't get that because they don't have a valid health card, could be a big problem for this person. And we've had that experience where someone has actually lapsed their health card. So beware, communicate that. That's important. Market surveys. So that's kind of a little bit the healthcare. If there's any other questions, because that's kind of like the big one that people are asking a lot of questions on, is we're finding that in our world, life is very different. There's not going to be a lot of movement with market surveys. So we have been told by the insurance companies, and I have always I've suspected this from day one, is that there's not going to be a lot of business moving from insurance company to insurance company. But because you've got to remember, there's lots of stuff, lots of change. We've got layoffs going on. We've got demographics, volumes going down. Guarantee rates aren't going to happen because you went from a 50 group to a 20 group. All sorts of stuff is changing the environment. So the insurance companies are saying, we expect that we're not going to be doing any new business for the next few months. In fact, they're saying into 2021. That said, if you are that person that is in the middle of something, and I give this as an example, is that we did have someone that was looking at changing, and because they've gone through major layoffs, we needed to communicate that back to the insurance company. So the numbers that we had been aware of a few months when things were just starting to move in the COVID space, it's not relevant today. It's just not relevant. So there is no promises. Doesn't matter what broker you have, there is no promises on information that's changed in the last few weeks as a result of COVID. So you need to make sure that anything that you might do for change, get it in writing. Don't just take it for assumption. That's important. I'm saying that a lot now. That's important. I'm not doing I'm going, that's important. It's all important. What can I say? It's all important. So on that note, talk to the consultants that you work with. Certainly bounce it back to us. I'd rather be very on top of that and not want to assume something and then have my client be very disappointed if it didn't work out the way they wanted it to be. So some miscellaneous things. An interesting one came up when we're talking about our health, mental, physical. Obviously at work, we always are talking about, are we got a good workplace to be in ergonomically? I know our office went through a complete ergonomic review, thanks to Bridges. We went with new chairs and workstations, and now everybody's home. They're all working from home. So we're hearing this, and Debbie is one of those classic, I'm sitting like this all the time, and I'm not in the best chair at home because it's not my chair that I work with every day. So I'm now that person that is starting to not feel very comfortable. My back is starting to give me problems. And number one, health is important. Physical movement is very, very more important than ever. And what we're seeing is from an employer's perspective, the question now is come back is going, not that my clients a lot have to worry about it. The private sector is a little bit different, I would believe, that in larger companies and maybe more public and union based. But duty to accommodate is that kind of buzzword out there. And what is your duty to accommodate someone at home in their workplace? Occupational health and safety says these are the things that you need to do to make sure that this employee is in the best comfortable environment. So one of the things that we didn't even think about before this came back as a conversation, I know a few of my employees are taking their chairs home because they've got a good chair. And I said, as long as you take it home and you bring it back in the same shape, I'm all good with that. So think about that. And you don't want your employees to get unhealthy because they're not in the right working environment at home. Sitting at a hard kitchen table chair maybe is not the best thing, right?
So wait, you're telling me people at our office have been taking the chairs home?
I think Lana, I don't know if Lana's listening, and yes. I'm all for it. I mean, hey, you got a truck, take it home, make sure you're sitting in a good chair. I mean, we just ordered them. They're all sitting here empty now.
Well, I came to work for the first time this week. I'm working from home right now, so again, it's Colton here. And I came to my office, and my chair is gone right now. So I don't know, did someone take my chair?
Wasn't me. Well, maybe it was the Easter Bunny.
I assumed it went into another room for some sort of other reason, but I wonder if someone took it home.
We better go follow the Easter Bunny. We're going to see where he's gone today.
I actually have no idea where my chair is right now.
Well, so a small tip, but just think about a bigger picture here is that you don't want that person that you need back to work now with a back problem because he's sitting in a bad chair. I know there's not the best solution and for all of us, but we got to make whatever we can make work now before we don't have that employee back to work. So I'm not looking, is there any, Matt just maybe that's where did the chair go? Matt's saying, I don't know. It's a mystery. Okay, so I know another thing that came back is privacy. What can I ask my employees? I think we're all over that now. You know what? If you suspect and you're not comfortable, you need to ask the question. The last thing you need to do is be that person that allows someone to spread that virus throughout. Even those people, I think there's some people still at work because they're essential services. You don't want someone that has a risk of passing that virus on in your organization. So again, if there's a question on how far you can go with that, definitely contact and get legal advice. And I think the last thing, our newsletter went out again this morning. It addressed a couple of the things that I talked about today, and the links we put on there. I don't have 100% of the information. I think everybody will probably agree with me. Every time we think we got it nailed down with the subsidies, they change them again. But the links that I know that are, quite reputable and current, we've put onto our newsletter. The Canadian Chamber of Commerce is a really good site. I went on it, and not only does it address the subsidies and some of the things that are going on in very simplistic language, but it gets into a couple other spaces that I think it's really good as a business owner. You might want to take the time to read through what they've provided. I mean, obviously Services Canada is there. I find that there's a little bit more difficult to navigate through. But the Canadian Chamber of Commerce, I know Sarita, they put it, so hats off to Sarita. They're putting together, some programs that they're hoping that can help some of the small business clients survive through these unprecedented times. So there is a lot of help out there, and there is a lot of resources out there. If you're wondering some questions and maybe we don't have the answers, we may have the ability to send you down the right path and get you those answers for you.
And so, on the note of resources too, again, we keep mentioning this, but we're just finding it's already working so great. We have the link for the private benefits group chat benefits group that we made on Facebook, and we are going to be posting any and all resources that we find there, starting to organize and put them in fashion that is easy for you guys to navigate through. And on top of that, we've been inviting a lot of professionals into this group as well. So suppliers, people in mental health, people in employment, and we're getting those folks engaged now, so that if you have a question that maybe we aren't able to answer, someone else in that group can too. And we had really great interaction. I know Jen, who's again watching this video,
and Pam. I know Pam's been good.
That we're back and forth, over the weekend. And we're not saying we're necessarily available to answer questions all the time, but that's exactly what we want this to be used for. If you're a business owner or manager, HR person who's dealing with the problem, and you're just wondering, hey, is anyone else going through this? What are you doing to get through it? this is the place that we want to create. So we really appreciate the interaction that we've already seen there. So again, please click that link and join, and we'll be sharing more resources there as well.
So basically just telling them to go to our Uyghurs Facebook to find it, Colton?
Yep, we'll have it. The link will be on this video.
Okay, perfect.
In the description of the video, and we'll do our best to keep it front and center. Yeah. And we'll try our best when we're talking to anyone we're chatting with, the clients and such, that we'll mention it to you, and we can send you a direct link. But on this video description, you'll have it. Matt posted a great link that one that you mentioned, Chamber of Commerce as well. So again, there's going to be a lot of good information posted there.
Sorry, I'm laughing because I see Jennifer's comment. Mine was a lawn chair at first. I'm sure if we were to take pictures of a lot of our workspaces at home, it'd probably scare us. So I know I've got, you have to understand I'm 4'11", so sitting at any table is not ergonomically 100% for me. So I've got 2 cushions sitting on my table or my chair right now. So yes, thank you, Colton. And thank you for those who joined our private group right now, because the uptake is there. We're excited to see that every day we see new people tapping in, and we're there sharing information to you. We want anybody that comes on, if something comes to your attention as a question of this private group, we want them to spin it back to the members, the audience in there, and this is meant to be interactive. And so this will be one of the things that we'll post on there is our toolkit. It will be available, and again, this isn't perfected, but we've gone through a lot of drafts, and we're trying to keep this very simplistic so that as you're reading it, you understand it. We're there to guide you, but we also need to know that you need to understand this so that when you communicate to the employee, he understands what you're saying, and that's more important. So there we go. More important. It's just more important. But on that note, it is the Easter weekend. I know that we were very, very fortunate to have a good start to our year, and we keep working hard. And thanks, team. And I want to shout out to in our private chat. I know a couple of our group, benefit team are on there, and Orlando's answered to a few questions. So when Colton mentions that we're not, I don't want to tell you we're going to be answering to questions 24/7, but Debbie is that person that does pick up and do a little bit of stuff after hours and on weekends. I know Lana did. So if it's something that's quite important, we will respond to it. Easter weekend, we're closing out early. We're going to go home and celebrate. It is looking nice outside. Perhaps we can go for an extra long walk. We can get on our video chat time with our friends and our family, because that's all we can do. Again, I'm sure everybody knows we don't want to cross that line and break out and violate the self-isolation rule. Because we want this thing to settle very quickly. It's still not even close to settling, and we all want to get back to the new normal. So have a very wonderful Easter. Enjoy your family in whatever way that might be. Stay safe, stay healthy, and absolutely remain optimistic. Have a good day.
Bye.
Bye-bye.